Hi, Gloria.
Hi, John. How's it going?
Good.
Patients and families benefit enormously from having care provided in their own home.
Is where people live their lives day to day. They don't live in the hospital. And so that's the place where a lot of people want to be.
People are so much more relaxed. They're so much more open to the medical care and treatment that we provide. We find that they have much better outcomes when they're able to be cared for at home.
Having somebody come to the home, you can have a real conversation and not be worried about, I'm on limited time. I mean, even though the time is limited, you're still given a longer period of time than the 20 minutes you get in a doctor's office.
We're hoping.
When does their weight gain slow down?
Usually after 6 months.
While it may be something that they too are nervous about, our team does this all the time. And so our ability to coach people, encourage them, set up plans so they feel really confident as a caregiver at home is one of our jobs.
Being able to help families take care of their own family members, I think gives them a sense of pride.
Because of the visiting nurse and hospice of Vermont and New Hampshire, I was able to take care of her at home. And she always took care of me. So it was my turn to take care of her.
Gloria came in. We found it immediately easy to talk to one another about what she was going to do and what I needed to be done. And it's usually been something in the way of cleaning and an outdoor need that I have.
I think there's advantages to not having to go to hospitals and clinics if you're not able to get there, but also if you have illnesses that might cause that to be a risk for you.
People being able to come home really is a safer place for them to be because they're not around other people. VNH takes great care in how we manage ourselves and our infection control practices so that we're very careful when we're coming in and out of patients' homes.
And Linda's been safe. She hasn't gotten colds or she never coughs or sneezes because she's safe.
I've lived the life of having family members insist on being home.
I think we spend a lot of time working with patients and families to understand what's really important to them during this chapter of their lives. And so our focus is really on supporting those things after we figure out what they are, and they're different for everyone.
The things that I didn't realize that they do, like the funeral services. They set up the funeral home. They take care of calling the ambulance or the hospital at the time when she passes.
Our whole team really works together to make an end-of-life experience be as positive as possible for the patient and their family.
I can actually sit here and be with her and not have to worry what's going to happen next, because it's all taken care of because of VNH. And that's a big deal. But they're going to be there with me.
Without these types of services, those of us who are caretaking our older relatives or our family members that otherwise would not be able to be at home would not be able to meet their wishes.
We depend on home health in many situations, and the vast majority of people that we see who we will do total joints on will go home, and they're not ready to get in and out of the house easily. They're not ready to get in and out of cars easily. They allow us to have eyes and ears in the patient's home.
That's good.
At least you won't be tripping over it, right?
No.
And if there's any problem at all, then we're able to bring the patient in and evaluate.
You want somebody who cares, and you can see it in their faces. They care. And the way they treat her, they care. And that's the biggest thing.
Being able to see firsthand and hear in real time the impact that we're making, that's my inspiration for doing the work that I do.
Perfect.
VNH has been invaluable.
VNH is here for everyone.
I look forward to Wednesdays.